We are doing TMJD. So it's really the dysfunction of the masseter. And so in a previous, during our assessment video, we did go over how to test for TMJD. And if your client presents signs of this, we're not going to diagnose them. We want to make sure that they get a proper diagnosis from their practitioner or from their dentist. And when they get that proper diagnosis, we can treat. We can also just treat the symptoms, right? So some things that we do want to focus on: anybody who is having some masseter pain, discomfort, clicking in the jaw, we can focus on the masseter, focus on the posterior or the anterior portion of the neck, which is going to be your SEM, your scalenes, your deep flexors, also your extensors, your lats, your upper traps, not your lats, but your upper traps, and also your thoracic and levator scapula. Very important. Levator scapula plays a role in so many things, and this is why a lot of people stay up here. They have so much discomfort up here.
And their shoulders like earrings.
Exactly. Even you'll notice a lot of tension in your pecs, around your sternum, if you're having some TMJ issues or dysfunctions. Another thing that I've noticed with certain clients is just constant headaches. I've usually trace it back to their masseter, and I test it, and it's usually masseter. So believe it or not, a masseter plays a really huge role in just how we feel in our neck. So once we release a lot of the facial muscles, we can help release the cervical region, also the top of the shoulders. Okay, so and today we're going to do pretty much a pin and stretch, because we're sticking with the stretch theme. We're not going to do any type of massaging or anything like that, but we're going to do a pin and stretch of the masseter. We're not going to do any type of intraoral work. I'm not a big fan of it. Do I do it? Yes, if I really need to get in there. But if I don't, I'm not. If I don't need to get into the mouth and get into those little intricate muscles, I stay on the outside. Make sure your hands are clean. For me, I like to use gloves if I am touching the face. And what you're going to do is always cup your client's head. Make sure that it's nice and relaxed. Okay, we can get some cervical spine mobilization in. Cup the back of the occipital region and just get some rotation. We can get some mobilization starting at the base of the cervical spine and pressing up towards the ceiling as the head goes back, and then work your way up towards their occipitals. As you press up, relax the neck, press up, press.
Key things to think about with the master is that there's the talking muscle, the chewing muscle. Oftentimes, if you get pain during chewing, that mastication, you're going to often get TMJ as a side result.
Yes, and yeah. Also, I was in high school and I fractured my mandible. So this is actually a dysfunction that I am very close to. I didn't know I had TMJD until I went to school, and then one of my classmates was like, "Oh yeah, you had that." I'm like, "Great, can you work on it?" And she did. So fractured mandible, if you fall straight on your chin like I did, you can get TMJD from your masseter just getting nice and tight. Luckily I did not have to have my mouth wired shut. I just couldn't talk for a really long time. And I had to eat very soft foods. And yeah, so a lot of these techniques I've learned over the years working with other people, but I've worked on myself doing scraping, some light cupping, trying to relieve all that because I chewed gum a lot after getting that injury, and that didn't help at all either. So yeah, so we're going to mobilize the cervical spine. Another way to mobilize the cervical spine that I showed you in another video with the carpal tunnel syndrome, we can come right here to the base of the spine. We're going to put a very light pressure in between the C7, C6, and then we're going to work our way up the cervical spine. My other hand is cupped right here, so I can just slide her head from side to side. This is that hand. And this hand, very gentle thumb pressure on the side of the vertebrae. And then as I put pressure, I'm just going to bring her head to the other side and then work my way up between 6 and 5, and then between 5 and 4. And then keep working your way up all the way until you get to the base of the skull. You can go a little bit beyond the base of the skull and mobilize. This is not a stretch, it's just a mobilization, so you're not pressing in there to irritate nerves and the side of the vertebrae. Okay, so once we get those mobilization in, we can do the same thing on the other side. Then I am keeping contact with them. I'm going to go straight for the masseter because this is what pretty much our focus is between the masseter and the temporalis. Having brain farts today. So we can do some light friction of the temporalis. You do want to work one at a time. You do not want to do both at the same time. That can be a lot for the person. It could be too much sensation. So just work on one at a time. If you want to get a really good scalp massage in, get a really good scalp massage in. But I'm just compress and release. Getting near that joint. And then I'm also going to friction along the border of the mandible. I'm right on the angle and I'm going along the border. So if you're familiar with your NMT training, this goes right along with NMT, which I love doing NMT during my stretch sessions. Then you're going to find the zygomatic arch, and we're going to friction along the zygomatic arch, starting at the joint, going out. And it's very small movements, very light pressure. We don't want to add bruising to our clients. Okay, now for the pin and stretch, you can use your thumb, very light pressure. And what you want your client to do is slowly open up their mouth as far open as possible. And bring it back a little bit slower next time, okay? And then we're going to work down until we get to the origin, the insertion of the masseter. So we're at the origin. Now we're at the belly. Open for me, nice and slow, and bring it back slowly. One more time for me.
Sorry, I was following.
I know. That's why I took my time. And then we go to the other side. Come right here. I got you. Try to relax your throat. And you can pull, clench your teeth for me. Just clench. And you're going to pull towards you, okay? And then as you pull, try to open your mouth, about getting like 20% of that strength opening. And let it go. So does that feel better now that your head is in this position? All right. That's all he was saying.
My next side.
All right. So now once we worked on the masseter and the temporalis, we can go into the neck. I'm going to attach a neck routine to this video. I'm not going to get into any type of neck stretches. It's pretty much the same for most people, depending on any type of dysfunction that I'm working on. And then once you're done with the neck, we can get into, if you know NMT or any type of other techniques for the SEM, go ahead and put it in there. For the scalings, go ahead and put it in there. But the stretches are the same as in the other video that I am attaching to this. Now, to show a thoracic mobilization or opener to get the serratus anterior, the intercostals, let's get into it. All right, so some thoracic mobilization in the seated position. All your stretches don't have to be laying down. They don't have to be on the side. They could be seated also. This is the beauty of stretching. If somebody is getting massage, you can't really sit them up and do anything, right? I like to start right here, get them relaxed while I'm behind them. And then I'm going to pretty much bring my fist into their thoracic region. My other hand is right here on the opposite shoulder. Have them breathe in for me. And as they exhale, I'm leaning into their thoracic region, opening up their thoracic spine, opening up their chest, and then bringing it back. Okay. You can also get the top of the traps right here while their arm is nice and rested. We can bring our forearm right here and just rest into their traps. And get a good massage that relax. There we go, let it go. Good, try to let your head go. Out to the side. Let me stop. All right, so a really good breathing opener. We're going to bring our knee on top of their, right there, right? And then we're going to bring their opposite arm right here. And then just to open them up, we'll give me a deep breath in, exhale. We're just gonna open, very gently open them up. My arm is between my body and their back. You can play around with rotation right here. You can lean back a little bit. You can bring them more into lateral flexion. Have them breathe right here. Deep breath in. Exhale, good. We can get into the serratus anterior by putting a little bit of pressure right there. There we go. Good. You up towards me. Deep breath in. Exhale. Deep breath in. Exhale. Oh, beautiful. I'll do the other side. Deep breath in for me. Exhale. Deep breath in. Exhale. I'm changing each point of contact. It won't let me. I'm not going to force it. We're not going to force adjustments. If it happens naturally, then it happens. Deep breath in. Exhale.
Adjustments are a chiropractic job.
Exactly. Adjustments are a chiropractor's job. So that's some really great way to open up the thoracic, open up. We did some really good breath work right there. You want to guide your clients into the breath work. As they're exhaling, that's when you want to get them into that stretch. Breathe with them. It helps a lot when you breathe with them. It helps you relax. It helps you pace yourself throughout the movements, okay? So that is the end of the TMJD, and I'll see you in your next lesson.